damage to homes and very, very important infrastructure, but it has raised serious public health concerns. The South African Medical Research Council is warning that these conditions create an elevated risk of disease outbreaks, from waterborne illnesses like cholera and diarrhea to vector-borne diseases such as malaria, especially in vulnerable communities where access to healthcare and clean water is compromised. We're going to be speaking to the South African Medical Research Council's Chief Specialist Scientist, Dr. Caradee Wright, about these emerging health risks and what communities need to know. Doc, thank you so much for joining us. Welcome to Salam Media. Really appreciate you giving us your time.
Thank you very much, and it's great to be with you this morning.
Which is all ours, and I think we'll jump right into it. Can you just describe and give us insight on how these recent floodings in provinces like Mpumalanga and Limpopo, as mentioned, have created conditions that are conducive or increase the risk of disease outbreaks?
Yeah, so we are really concerned because the floods have, as you've said, compromised water access as well as access to healthcare. So what we're worried about immediately is obviously the people who have lost family members and friends, and the mental health impacts that poses to these communities, as well as the concern for loss of access to schooling. In this case, many children are not able to get to school. The schools have been damaged or they're just inaccessible. And of course, a lot of these children rely on the nutrition feeding program. So we then have concerns about malnutrition and food safety and security. And then, of course, in the coming weeks, as the water subsides, some of that water may remain and it could become breeding grounds for things like mosquitoes, which will then enhance the malaria cases.
I think that's very, very concerning, especially in some of the most vulnerable parts of our communities. Is this malaria the only disease which you are concerned about in the weeks following, or are there others that are of concern also? And can you expand on that a bit?
Yeah, sure. So no, it's not only malaria. It is the malaria season in South Africa, in Mpumalanga and Limpopo. So that is an immediate concern. But there are other things. The one that I'm most worried about is diarrheal disease. So with people not able to have fresh, clean water to be able to keep good hygiene and keep washing hands and being clean, the risk of diarrhea increases really a lot. And so the things that people need to do is, if they have access to water, even if it's not necessarily clean water, make sure that you boil that water before you use it to wash hands, and obviously for consumption.
And how quickly can we maybe expect to see some of these spikes in those waterborne or vector-borne illnesses, based on maybe past experiences or maybe modeling of some sort?
Yeah, sure. So the research community works very hard to try and predict these kinds of things. It's not easy. I suspect it's difficult to say, because the data that we need that's happening on the ground now is going to take some time to start to filter in. But given predictions or projections from the past, we're likely to see an increase in these kinds of outcomes, at least for the next 2 or 3 months.
Very concerning, Doc. And when it comes to individuals that are at risk, are there any demographics, whether being children or the elderly, that could be maybe at a higher risk of contracting these diseases? And can there be anything be done to try and mitigate the effect of this eventuality?
So vulnerable groups are our biggest concern, and these include infants, pregnant women, people with pre-existing diseases, people with physical and mental challenges. And these are people, and older adults, as you said. And these are people that in many instances require extra care. So what we usually recommend is look after each other, whether it's your family members or it's your greater community. These vulnerable people really do need a helping hand. And so when we are deploying things like the mobile health facilities to these areas, encourage these vulnerable people to use those facilities if they need to.
And just long term, because it almost feels like with climate change and this kind of weather phenomenons becoming more frequent, are there some factors that can be put into place to make sure that these health risks are going to be contained moving forward? Because it looks like this is going to be a norm. We're going to be seeing extreme weather conditions for the incoming future now.
That's right. So we don't know for sure if this flood event that's happened now is related to climate change, but this is exactly the kind of thing we are going to see in the coming years, at least until the end of this century. These extreme weather events, this flooding does happen every year in this part of South Africa, but it's more intense and it's wreaking much more havoc than it did in the past. And I think one of the main reasons for that is our infrastructure is failing us. Roads and bridges, and these are the connectors that get people to healthcare. And if they can't get to these spaces, the increased risk of ill health increases. So we have to make sure that our infrastructure is working properly. That also includes access to running water. And then to ensure healthcare workers can actually get to these primary healthcare facilities. And the other thing that we really need is preparedness, much better preparedness, so that we can be proactive rather than react after the fact.
No, most definitely. And lastly, before I let you go, Doc, any parting shot message to people that are in those areas, Mpumalanga, Limpopo areas? Are there any steps that they can take to try and protect themselves, to try and protect, their families from these diseases? I think it would be very, very important to share those tips and tricks of how to go about it.
So I think first and foremost is look after each other. As we've said, we have to work together as a family or as a community to make sure that everyone is safe. I think Gift of the Givers is helping with food supplies. There's mobile health facilities. Please make sure that you use these. If you have been injured, please look after those wounds and seek care if you see that something is not right with the wound. And most of all, please try and stay safe. Don't try and undertake something that looks very risky. We want to try and save as many lives as possible.
Oh, there you have it. Thank you so much, Doc. Really, really appreciate you giving us your time.
Thank you for having me.
Dr. Caradee, Wright from the South African Medical Research Center, they're giving us, I think, a very, very concerning picture. But again, you look back to government and say, as the doctor said, almost every year we know that there's going to be this kind of extreme weather phenomenons in part of Mpumalanga, Limpopo, going up to the north. But we never really are prepared. We always found wanting. It almost seems like it's a surprise almost every year. And I know ever since I was born, even in the early 2000s, in the late parts of December going to the new year, there's always floods in Mpumalanga, Limpopo, Mozambique. Another case, I think I remember in 2002 there were those big floods, and one person wrote on social media, which I thought it was interesting, that since those floods in 2002, they've been actually occurring in Mozambique and parts of Limpopo and Mpumalanga almost every single year. But the Mozambican government still to this day relies on South Africa's Air Force to airlift their people out should those floods happen. And the real truth is they do happen almost every year. So it talks to the preparedness of our governments, the South African government also. We know almost each and every year we're going to have these floods. Earlier on in the year, it's going to happen in Limpopo, Mpumalanga, and then later on in the year, the KZN experiences, such weather phenomenons also. But we are always found wanting, and ultimately, we're going to be at a place where there's going to be, outside of the effects of the floods, there's going to be a follow-up. There's going to be diseases that break out because of the inclement weather conditions. So malaria, diarrhea, waterborne diseases, which in a country like ours, a country like South Africa, which is head and shoulders above everyone else, or should be at least heads and shoulders above everyone else on the African continent when it comes to how we deal with such things, you think malaria shouldn't be be a problem in South Africa in 2026. Cholera shouldn't be a problem in South Africa in 2026. But again, we find ourselves being failed by the very people that are supposed to be protecting us. And I think this is a wake-up call for a lot of South Africans, especially leading up to the local government elections. It cannot be business as usual. At some point, things need to change because things are starting to affect you directly. I think that there was a point in a time where infrastructure failures and the rising cost of living and this little things, man, that make South Africa become almost unbearable to live in. We're only affecting a certain portion of our society, but we're not really affecting everyone. So there was almost a disassociation from, let's be honest, majority of the middle class in South Africa, but it's starting to affect you now. You can be in the northern suburbs of the country and you can go 2 weeks without running water coming out of your tap. You can go 3-4 days without electricity. You can drive out of your house and it's pothole after pothole. It's a construction site that was unfinished and ditches that have been dug that have just yellow tape around them. And you're like, when did this get here? And that's the real wake-up call, because everyone is starting to experience what the lower class citizens, people that reside in townships or in the far-flung areas of the cities or in rural areas, have always been experiencing. These horrendous failures of our municipalities, which are so reactionary. I mean, just look at the accident with the Val kids and what happened there. So you have 14 children losing their lives, and all of a sudden, all over social media, it's roadblock after roadblock and a scholar transport, which has been assessed and looked at by the traffic department. Did you like, did we have to lose 14 kids for you to act? Can't let our country fail. And I think maybe, just maybe, it's a good thing that these service delivery failures are starting to affect everyone. Because, well, remember how, or the comments that people would make when people from Soweto, Tembisa, from Alex would close down roads and protest and cause traffic. It'll be a nuisance of some sort. Like, do they have to do that? I have to get to it. But now you understand. And I hope you'll do something about it. Going to take a quick break. When we come back, we're going to be having our hashtag Africa Focus feature as part of the show. We focus on the African continent, and we'll be heading over to South Sudan. We'll be speaking with Mayen Manyon. He's a South Sudanese-based journalist, writer, and editor. And we're going to be looking at an interesting story, a crisis that is unfolding in Sudan. Civilians and the UN have been told to flee ahead of assault the essentially war that's seemingly bubbling and going to be breaking out in that part of the continent. So it's going to be another interesting news piece to take a look at. But we'll come back after a short break with our hashtag Africa Focus feature.